everyone, my name is Jasmine. I am standing here in front of you, having to show a presentation. So please lend me your ears as I present my topic. It is said that nurses are angels of the sick room. As a nurse by profession, I am going to present about health care in CNC. Do you have any idea about the common disease in the Philippines? Well, there are 3 common diseases that anyone may get. These are dengue fever and cold and waterborne disease. First, let's talk about dengue fever. Dengue is a virus spread through mosquito bite that creates symptoms including high fever and severe headache and pain, rash, and mild bleeding. A rash usually appears in sight when it has fever before and after 3 to 2 days. These clinical symptoms last more than 10 days and take up 2 to 4 weeks to be cured. Dengue fever occurs mainly in tropical and subtropical climate. After rainy season, assume the prevalence of this disease for a short period of time. The incubation period is about 5 to 7 days, and the infection can be transmitted between human to human. In the Philippines case, there is sudden announcement about dengue fever warning. Sometimes we can see dengue fever patients because dengue has higher rates than malaria. We can get this disease anywhere, anytime in the Philippines, and there is no vaccine or treatment, so we must be careful always, and public health efforts are largely focused on helping people take steps to prevent being infected with the disease. If we can find out during the first stage, it can be treated easily. But if we lapses into a late stage, the lethality will increase and it can cause death. Actually, dengue fever's lethality is 1 to 2.5%. So we should focus on relieving the symptoms and careful observation of the change in the occurrence of dengue hemorrhage infection symptoms. Anyway, dengue fever usually becomes better by itself within about a week. So if we are careful and if we pay attention about that, we can be better without after effect. If we have got dengue fever, we should do the following. 1. Sorry. One, we have to stay at home as possible and we must take enough rest. 2, we have to make sure that body temperature is not higher than 39 degrees Celsius. 3, we must have enough nutrition intake and drink enough water in order to avoid dehydration. 4, we can take medicine. Listen carefully. Paracetamol helps to relieve most pain and alleviate fever. But non-steroidal medicine, for example aspirin, can aggravate an illness. So we only have to take codeine and acetaminophen, for example Tylenol. When we have got fever and headache and myalgia, acetaminophen or paracetamol functions as antipyretic and analgesic. Is an active ingredient in Tylenol and Gabriel. Second, let's talk about cold. In the case of the Philippines, due to the hot and humid climate, having a cold can be thought strange, but in a tropical country, cold is more severe, over and stay for a long time. Usually we can get cold that is caused by temperature gap between the inside and outside. Actually, we are exposed to such an environment. And cold separated by contact between people because management contagion is very easy. In the case of a cold, the symptoms are sneeze, headache, fatigue, chills, sore throat, nasal inflammation, having a runny nose, and other symptoms usually last for a few days without fever. In the early days of mucus being to appear, gradually increase the amount of concentration becomes big. It also comes out with a cough and phlegm, such as the adenovirus that causes cold for more than approximately 100 species are known. One kind of virus in some cases can cause many different symptoms. The virus that causes it is difficult to figure out. In addition, even in the same clinical symptoms of the patient, one's age, residence, and social condition depend on the onset. However, in most cases, sufficient rest and adequate fluid intake are needed to relieve the symptoms, usually 3 to 4 days or so if the symptoms disappeared and the disease itself is there. A natural drug of the Philippines is calamansi. Calamansi is a tropical fruit that can be cultivated for years. Philippines is very abundant in calamansi more than lemon. In addition to being a very rich source of vitamin C, it is closer to that of lemon. So, even though it has a strong sour taste, it helps relieve fatigue and currency thirst. It also helps cure cold and tonsillitis. When coming down with a cold, at that time, calamansi juice mixed with warm water and drinks is helpful alleviating the symptoms. We can get it easily. Third, waterborne disease. The waterborne disease is caused by water and food contamination of microbes. Therefore, we have to be careful of the water we drink and food we eat. Waterborne disease, most of the pathogens grow in the gastrointestinal tract inflammation. So abdominal pain and diarrhea, nausea, vomiting, and sometimes the main symptoms are accompanied by headache. Guidelines to prevent waterborne disease. 1. We should always wash our hands with soap and clean water. 2. Food should be stored in refrigerator. 3. If possible, we should always cook our food and boil the water. That will make it more safe. 4. Especially on familiar food or street food must be eaten with caution. That's the end of my presentation. I already have had sickness experience in CNC. At that time, my CNC friends helped me. so I can standing here. Thank you so much. And I hope that every will stay healthy while studying here. Enjoy your senior life. Thank you for coming.